Personality disorders are difficult to define, and the reliability of them is notoriously low. We keep laboring under the assumption that there is some kind of specific treatment for these different disorders. There is no specific treatment for any specific psychiatric disorder that we know of. Interpersonal psychotherapy, which was developed for depression and has been found to work in almost an unchanged form with anorexia and bulimia and general anxiety disorder and stimulant abuse and heroin abuse and marital therapy. I mean, what do those things have in common? Not much, except they all respond to interpersonal therapy. The take-home message here is there is very little in the way of specific treatments. If you learn a treatment or a set of treatment strategies in psychotherapy, you can tailor them to fit a wide variety of problems.
You need the historians to tell you literally what went on. You need kind of sociologists, psychologists, everybody trying to pull together information so that you have an accurate basis for drawing psychological generalities. If you look at the 20th century, it is literally strewn with examples of mass killing. It's just on too vast a scale, too repetitive to say this is the work of somebody who's crazy. That doesn't work. It's more to be understood in terms of situational pressures. Many individuals, including high-ranking Nazi war criminals, participated in atrocities without having any diagnosable impairments. In this sense, the origins of Nazi Germany should be sought for primarily in the context of social, cultural, political, and personality, rather than clinical psychological factors. Familiarize yourself with what happened and then try to extract commonalities across these horrific events. Where is Rwanda? And it's right here. If you go to Rwanda, this is the back of a church, and you can see many people are dying from having their skulls crashed. One of the consequences of this is that the whole country is pretty much suffering PTSD. There's a State Department briefing, and the lady, she's a woman who's the spokesperson for the State Department, and people say, well, are you aware of the acts, what's going on in Rwanda, the genocide in Rwanda? And she said, well, we don't know that it's a genocide. There are acts of genocide in Rwanda. And somebody raises their hand and says, how many acts of genocide does it take to make a genocide?
By appreciating social psychology, you're going to be a better therapist. Okay, so the title of the talk is The Lucifer Effect, Understanding How Good People Turn Evil. Lucifer means light, okay? And the Lucifer effect was the fact that God's favorite angel became the devil. Good people, ordinary people, average people, begin to do things which move toward the evil side, move toward the bad side. What makes people do things that we all would agree are evil? We usually say, who is to blame? When you ask that question, you have a very biased answer. If you ask who is to blame, it can only be a person. We say what is to blame? It could be a person, but it also could be the situation. Let's assume that they were good at some point prior to this. What could account for the behavioral transformations? Dispositional, the situation, the system. And this is what I call the bad barrel makers. The human mind's complexity has templates for love and hate, for good and evil in all of us. Anything any human being has ever done, we could do under those circumstances. The line between good and evil lies in the center of every human heart. It's not abstract, it's not out there, it's right there.